Ever wonder why your healthcare and insurance costs are skyrocketing, even as broader inflation cools down? Let's dive in.
General inflation is finally slowing down globally, right? But your medical bills and premiums, yeah, they're still climbing fast.
Look at the data. US medical inflation is beating consumer prices, and the global trend? A whopping 12%. So what's the deal? What is the actual engine driving up the underlying cost of care right now? Hospitals are facing massive pressure. Think severe labor shortages, high energy bills, and super expensive new medical tech. Social inflation plays a massive role too. In 2024, the average top medical malpractice verdict hit $56 million. Plus, postponing all those pandemic procedures really disrupted hospital revenues, making long-term patient care a lot more complex. But here's the million-dollar question. Why is this inflation hitting us now, years after the broader economic peak? Well, healthcare is a lagging indicator. Prices are locked into sticky, multi-year contracts between providers and big insurance companies. And since healthcare is super labor-intensive, facilities have to hike wages just to keep staff, without instant productivity gains. So, when those massive 2022 inflation spikes finally trigger contract renewals, those costs crash directly into you, the consumer. The real squeeze? That administrative lag effect ultimately lands squarely on your monthly health insurance premiums. This isn't just a local issue, folks. It's a global phenomenon, hitting both public and private systems worldwide. Private insurance prices are actually rising way faster than public programs, hitting everyday workers' wallets incredibly hard. But public systems aren't safe either. Even Medicare Part B saw a staggering nearly 15% premium jump recently. Now, this delayed inflation creates a pretty terrifying compounding effect on your long-term finances and future retirement plans. Just a 2-year burst of high medical inflation adds $250,000 to a 45-year-old couple's retirement burden. Crazy. Why? Because inflation compounds. Each price jump sets a permanently higher baseline for literally every medical expense in retirement. Shockingly, that same 45-year-old couple might need 156% of their Social Security just for healthcare. The delayed inflation wave is crashing now. How is your financial plan adjusting to survive this new normal?